Hello, for my pharmacology project, I'm gonna go over my PowerPoint and I'm gonna discuss the antipsychotic class drug. Um, so starting with the first slide, I'm gonna talk about what are antipsychotic drugs and what they're used for. Antipsychotic drugs, they are used to treat serious mental illnesses such as induced psychosis, schizophrenia, and autism. They also can treat acute mania attack, which we can see with bipolar and certain movement disorders. Some of the most common psychotics are haloperidol, which is Haldol, and risperidone. This we can see these a lot in the hospital. So, I'm gonna discuss now the pharmacodynamics. How do these drugs, like the mechanism of action, how the drugs are metabolized in the body and distributed and eliminated from the body. First, mechanism of action, antipsychotics, they work by blocking the dopamine receptors in the brain, which decreasing the dopamine concentration in the central nervous system and one nervous system. When they're taken orally, antipsychotic drugs pass through the gastrointestinal tract into the small intestine where absorption take place. And how are these drugs metabolized? CYP450 enzyme are the major family of drug metabolism enzymes that influence antipsychotic metabolism. Most antipsychotics are highly soluble in lipids and protein bonds. Okay, indication and usage. What are these medication used for and in their indication? Antipsychotic drugs are indicated for psychotic illnesses, the most common schizophrenia, as we discussed before. Several of atypical antipsychotic drugs are used as adjunctive therapy for depression and as an anti-anxiety effect due to its additional blockage of the dopamine receptor in the brainstem reticular system. Antipsychotics can be used when a person experiences symptoms such as delusion, which is when somebody is when they see people that they do not exist or they're not there, and most of the time it's the same person. And they also cause hallucination, which are hearing voices that are not real. Antipsychotics can also help with mood changes associated with the bipolar disorder, and they can suppress inappropriate behavioral. Contraindication, like any other drug, antipsychotic have multiple contraindication to consider. We're gonna discuss just the most common one, which is drug allergy. They depress the central nervous system. They can cause brain damage, especially if abused. They can also cause liver and kidney disease, blood dyscrasias, and epilepsy, which is seizure. Adverse effect, there are several adverse effects, for example, hematological effect, granulocytosis. They can cause a severe effect, which is neuropathic malignant syndrome, described as unstable blood pressure and high fever. Another dangerous effect is extrapyramidal symptoms, which are involuntary motor symptoms such as dystonia, which is muscle contraction, and tardive dyskinesia, which is irregular jerky movement. They also have histamine effect, which can cause sedative drowsiness, hypotension, and weight gain, and cholinergic effect, which is dry mouth, constipation, and fluid retention. For dosage and administration, I'm gonna just discuss haloperidol, which can be taken PO, IM, or IV, 0.5 to 5 milligram 2 times a day, and can be used for acute attacks, abnormal behaviors. And the last slide, which is client education, and educate client not to take alcohol, to wait several weeks. It can take several weeks to show effects, so we don't want to stop the medication abruptly. Teach adverse effects, teach client about when to call the provider, teach the client how to avoid drug and food interactions, what clients should avoid, such as using a grapefruit can raise antipsychotic drugs effect, and alcohol can increase drowsiness and sedation. Thank you.